Modified Progressive Relaxation is a super helpful tool in voice rehabilitation. The goal of this exercise is to learn how to isolate specific muscle groups and understand what the difference is between when they are maximally tense versus when they feel relaxed. The more we practice this, noticing the difference between maximal tension and conscious relaxation, the better able we will be to consciously relax our voice when we need to in periods of high vocal demand. It'll take about 10 minutes to complete this exercise. For the first week or two, it's recommended that you practice twice per day until you get the hang of it. You want to find a comfortable, quiet place to sit, close your eyes, let your body go loose, and take 5 relaxing, diaphragmatic breaths to help you settle in. Before we get started, I want to caution you if you have any physical injuries in your face, neck, or chest, please consult with your appropriate medical healthcare provider to make sure that these exercises are appropriate for you and will not cause further damage. I am going to guide you through the muscle groups one by one, specifically those that are in the spider web related to voice. That's why it's called the modified version. Once you know which muscles we're targeting, during the tensing period, I want you to squeeze those muscles as hard as you can and hold that tight squeeze for 5 seconds. While you are tensing, I want you to really pay attention to how tight it feels. You might even get to the point where you feel shaking that you're tensing so hard. Importantly, we need to build skill at isolating the muscle groups. You want to really only tense the muscles I'm instructing you to while keeping the other muscle groups relaxed. After you are maximally tight for 5 seconds, consciously let all of that tightness go as you exhale. Breathe the tension out of your body. The whole point of this exercise is to notice the difference between tension and relaxation. You remain in this relaxed state for about 15 seconds before we target the next muscle group. We know that many voice disorders are caused by improper or overuse of the muscles in your face, neck, and chest. This activity will help you build awareness of when you are overusing your muscles. Speaking should be effortless. Your abdominals should be doing all of the work through your diaphragmatic breathing, and there should be no strain in your throat. We've reviewed in my videos about how the voice works that the Bernoulli effect and resonance are going to make your voice effortless, beautiful, and loud. There are 3 levels of skill with this exercise. Level 1 is where we are maximally tightening our muscles. Level 2 is when we go through the same muscle groups, but this time we're only moderately tightening our muscles. Skill level 3 involves you being able to tune into isolated muscle groups and consciously relax them. Without further ado, let's get started. Get comfortable in your chair and start with your abdominal breathing. As a reminder, if you place a hand on your chest, your hand should not be moving. Only the hand that's over top of your belly button should be moving in and out. This is actually a great exercise to do while lying down, because when you are lying down, gravity sits on your chest, and most people automatically resort to diaphragmatic breathing. This is a great exercise to do first thing in the morning when you wake up and/or last thing before you go to sleep at night. Get ready to start our first muscle group. Let's start with our forehead. I want you to lift your eyebrows as high as you can, tightening them as much as you can. Hold that for 5 seconds. 3, 2, 1. Exhale and relax. Feel all of the tension leaving your body. One of my favorite breathing exercises to do is color breathing. You pick a relaxing color. Mine is a gold sparkly mist. When you inhale, you imagine it percolating through your lungs into your bloodstream, down to the tips of your toes, down to the tips of your fingers. And I picture the golden glitter entering the cells, scraping out all of this gunk. The color I picture for tension is this black, oily, purplish, greenish muck. The golden sparkles scrape it out of every cell in my body, put it in my bloodstream, take it back to my lungs. And I visualize exhaling all of that gunk. All of my stress and all of my tension are released with my exhale. You might like to try this color breathing during the 15 seconds of relaxation between muscle tension groups. Next, we are going to target the eye area. I want you to now squint and furrow your brow for 5 seconds as tight as you can. 3, 2, 1, and relax. Try your color breathing. Inhale that calm, relaxing color. Send it to the tips of your toes, tips of your fingers, and Exhale all the garbage, all the tension. Pay attention to the difference between when your muscles are maximally tense versus what they feel like when they are completely relaxed. Inhale that beautiful, relaxing color and exhale all of the garbage and tension. The next muscle group is our jaw. I want you to bite down hard for 5 seconds. Bite. 3, 2, 1. Consciously relax your jaw. Breathe in that relaxing color. Exhale all the tension. Notice what your jaw feels like when it's relaxed. Our next muscle group is the tongue. Pull your tongue up against the ridge behind your top front teeth and push as hard as you can. 3, 2, 1, and relax. Let your tongue go completely flat. There's no tension in your tongue. Do some color breathing. Breathe that beautiful color in and exhale all that tension. Our next muscle group is the neck. You're going to pull your head back and tuck your chin down. We're stretching the back muscles of our neck. Hold it for 5 seconds. 2, 1, and relax. Breathe in that relaxing color. Exhale all the tension and pay attention to what your neck feels like when it's relaxed. Next is our shoulders. I want you to lift your shoulders up to your earlobes for 5 seconds. Hold it in maximally tight position. 4, 3, 2, 1. Exhale and relax. Notice what it feels like when your shoulders feel relaxed. Breathe your relaxing color in. Exhale out that yucky color. The next muscle group is our laryngeal area, right where your Adam's apple is. You're going to pretend that you're lifting something heavy. You're going to close off your airway and bear down as though you're lifting something heavy. Let's do it together. Take a breath and bear down for 5 seconds. And relax. Breathe in. This time, let's breathe in with a yawn. And breathe out on a sigh. Breathe in on a yawn. Exhale on a sigh. What does your throat feel like when it's completely relaxed? Our next muscle group is our chest muscles. In all of my videos, I've been telling you to stop using them. This time, I'm telling you the opposite. Use your chest muscles, pull them up and out as much as you can to notice what it feels like when they are maximally tense. Ready? Here we go. Breathe in. Hold it for 5 seconds. 3, 2, 1. Relax. Notice what it feels like when your chest muscles are disengaged and relax. Revert to diaphragmatic breathing and do your color breathing. Breathe in and exhale all the tension. Finally, our last muscle group is the abdominals. I want you to tighten your abdominals by squeezing them inward towards your spine. Let's go. Tighten, tighten. 3, 2, 1. Relax. Breathe in that relaxing color. Exhale all the garbage. And that's how you do modified progressive relaxation. I hope you feel as relaxed as I do after that.